Hello everyone, once again welcome to my YouTube channel. Today I came with my second letter correction. This is one of my students' letter and the question paper is Mr. MC Donald's tissue viability nurses referral. So you could see the question in the starting of this video and you can just have screenshot if you want to write the letter by yourself. Okay, so we will see the costing. Just a brief explanation of the costing is you have to know what is the job description of tissue viability nurse because it's not familiar in our place. But in European countries, we have specialized nurses for skin integrity. If there is any issues like bed sore, pressure sore, venous ulcer, arterial ulcer, or if there is any skin injuries, something is related to skin, we could refer the patient or resident to tissue viability nurse. So they are the ones specialized in that area. And the thing what you have to know is their recommendations are purely related to wound care, not related to nursing care. So that's what I just want to emphasize in this question paper, especially in the writing task. When you write the recommendation paragraph, concentrate only on wound care management. Okay, so you should not write everything what they have given in the discharge plan or recommendations. In this letter, actually, the patient has some issues with the skin integrity, and as a community nurse, we started already some dressings and other preventive measures, but it went deep and started become infection to be infected with the pus and everything. So we referred the patient to the hospital for debridement, and after surgery or after the surgical procedure, the patient returned back to home. And we need some more wound care, like a specialized care at home. So this is a home visit. Okay, so we are requesting home visit to a tissue viability nurse. But you may get confused with the recommendation. What they did at hospital, that's the same thing what they are going to do at home also. So just keep it in your mind what all the recommendations should be there in this letter and preserve it to be in the recommendation paragraph instead in the present medical paragraph. So if you could not understand what I am talking, you can just refer to the question paper thoroughly, then go to the answer sheet. So it will be clear. Okay, because there is no special recommendations given in the question paper separately. It's in the present medical paragraph, in the present medical content. That's what I just want to distinguish between. Anyway, we will go to the answer sheet. So 19 February 2022 is correct. The month should be, the first letter should be caps lock. And in the address, Miss Olivia Somers, Tissue Viability Nurse, Community Medical Center, Australia. So if the designation is not given directly, you could find out from the question paper. Of course, they may give the designation. Sometimes name would not be there, so you can just start with the tissue viability nurse. Okay, and the first letters should be caps lock, like tissue viability, TVN should be caps lock, community medical center, CMC should be caps lock. These are the things. It's just like you can keep it in your mind. Dear Miss Amos, comma is optional. If you keep comma here after yours sincerely or faithfully, how to keep comma as well. Regarding Mr. MC Donald, aged 80 years. So here Mr. MC Donald aged 80. That's enough. So no need to mention years, just 80 is enough. This is to introduce Mr. MC Donald, who requires further care and management at your facility. So you can just introduce by complete name. This is to introduce Mr. MC Donald, who requires further care. Instead of further care, you could specifically give some name like further wound care. Care and management, that are synonyms, so you can use either one, like who requires further wound care, continued wound care, ongoing wound care, whatever you can use. At your facility and from your facility, both are different. At your facility means you are going to admit the patient in their institution. From your facility means you are getting someone from there to give care at home. So here actually from your service or at your service is better to use. At your service or from your service is both same meaning, but at your facility and from your facility is totally different. So this is to introduce Mr. MC Donald, who requires further wound care from your service. He has undergone wound debridement procedure and is being discharged today. So in the question paper, it is clear that already patient got discharged. So Mr. Donald is wrong if you write like this. So he has undergone wound debridement. All those things are related to wound debridement for
After
his pets
introduction,
or
in
directly
dry
you have to go
buttock.
to
So
the
if you
present
specifically
medical
mention, it would
paragraph,
be
not to
great.
the social paragraph. Full stop.
If it
And
is
he's being
required, you
discharged
can
today, no
select
need,
few
because
points and
he
you can write it
already
in the
got
present medical
discharged,
paragraph, but not
okay.
exactly all
So that
social
is the
things.
introduction
But in
part.
case of social worker letter, in letter to a social worker, you can write social paragraph after introduction. So what we have to do here? Mr. Donald has been under my nursing service for many years since he is a veteran. So it is a brief explanation what you are giving to tissue viability nurse. So when they read your letter, everything has to be clear. Okay, everything has to be organized. Then you can write for what he's getting management. So we already mentioned that he has been, or Mr. Donald has been under my nursing service for many years since he is a bedridden, who depends on who depends for or who depends on daily nursing care. Oh, that's optional. Okay. Then what next you can write? What are things that's happened since the initial stage of his pressure sore? So you can start like initially or not initially. So you could not use like initially, recently. Okay, instead of initially, you can use recently. On 9 January 2022, comma, he presented with diarrhea and incontinence of bowel. Both are same, right? So you can write he presented with incontinence of bowel and bladder, for which he was catheterized. So that is in a single sentence. You could finish it off. On the subsequent day, he had incontinence of bladder, for which he was. So instead of these two sentences, you can make it single sentence. Then you can write subsequently on 25 January 2022. This is the starting of bed sore. He had small blister on, not over, on right buttocks, comma, small superficial wound along with the red and broken skin. Okay, along with the red and broken skin, comma. Therefore, therefore the spelling have to be taken care. Okay, therefore, for which everything, those old phrases you have to be familiar with. I mean the spellings and the comma before therefore and after therefore you have to keep comma. Before however and even though you could use semicolon, and after you have to keep comma. Before for which you have to keep comma, not after. Also same like before. And also actually always use in the starting, I mean in the starting of a sentence. All right, so here you can write for which or therefore. So one connective you have to use only one time. So here you can use therefore he was managed. This is the letter to tissue viability now. So you can mention all preventive or management what you have given. So he was managed with alternative pressure resistant mattress or dry dressing or whatever the things is given in the house question paper, you can write. If it is still ongoing, you have to use has been. If it is completely finished, you can use was. He was managed with. Okay. And then so in this I mean in this answer sheet, I could tell that it is incomplete. The sentences are incomplete because it's there actually there is nothing related to the surgery, why he has been referred for the surgery, exactly what they did there, why we are referring the patient. So every data are missing. So in the next paragraph you can write on consequent days. Okay, what are the changes, what are the things that's happened here? You can just mention that on free on consequent days, comma, Mr. Donald was continued with dressing, comma, even though, comma, he has no progress, comma, therefore, comma, he was referred to the hospital for the surgery or hospital for the procedure. We already mentioned the surgery name in the introduction, so no need to mention the procedure name. You can just mention the surgical procedure. Then full stop, you can just write he was during hospitalization, comma, he was managed conservatively and discharged back to home, comma, however further attention from your service is essential for his well-being. So this is additional sentence you can use, make use in every letter. What is that special term like sentence? However, further attention from your service is essential for his or her well-being. Okay, by that we can conclude the paragraph. Why I didn't use the management what they did in the hospital?
because we don't have any other recommendations to write in the last paragraph. We could not use catheter changes or repositioning or normal nursing care for TVN letter. That's what I just preserved these sentences for the recommendation paragraph. Okay. Next, we will go to the social paragraph. As it is here, Mr. Donald is a retired policeman who lives with his son. It's okay. He has habit of smoking and drinking for the past. No need to write like that. Simply, you can write he smokes and drinks for the past 55 and 45 years. That's enough. In addition, he has had diabetes mellitus along with the hypertension since 1975 and 1980 respectively. So two times you should not use respectively. Only one time. Okay. As well as he underwent a right below knee amputation in 2005. Currently, he is on medications such as insulin. So if you wrote diabetes mellitus first, you have to write regarding insulin first. That's the thing. 15 units in the morning, semicolon, mixture 10 units at night, semicolon, and if pin, comma, 20 mg, comma, twice a day, semicolon, furosemide, comma, 40 mg, comma, twice a daily, ancestral, comma, 10 mg, comma, daily. So this is the peculiar way to write medication. Okay, so the medication name, comma, dosage, comma, frequency, then semicolon, then next medication. Before the last medication, you can use and. Subsequently, he was provided with that and all, no need. Okay, it should not be we could not write these things in the social paragraph. That's all regarding the social paragraph. You are writing a letter to a nurse, so you have to mention every conditions and medications as well. So this is a last part of the letter, the recommendation paragraph. It would be appreciated if you could visit, because it's a home visit, if you could visit to Mr. Donald. It's a wrong thing, so you can mention it would be appreciated if you could visit Mr. Donald for his regular wound care. Full stop. Okay, so the next thing what you have to write means we have two things. So you can pick up from the question paper. Please irrigate his wound with prontosin as well as pack with ticardum and silver nitrate. So whatever the things it is given, you can just write the same thing. Full stop. Then you can write, please continue the use of silver for his wound dressing until no more signs of pus. Okay, so these are all the two things what they did at home during debridement or after debridement. That's what the TVN has to be continued after discharge also. So you can just mention it here. Please do not hesitate to contact me for further queries. Full stop. Yours sincerely, the name of the reader is given, so you can write yours sincerely. After the name, if we keep comma, you have to keep comma here as well. Community health nurse, not community nurse, community health nurse. Okay, so by this I hope you have a clear idea how to write a letter to the tissue viability nurse. So always just think about the job responsibility of a particular person, like a specialist, or if someone like in a special area given. Even the doctors is okay, at least like psychiatrist, psychologist, and tissue viability nurse, practical nurse and community health nurse, both they are okay, same, like we have to give complete information to them. But diabetic nurse, tissue viability nurse, stomach care nurse, wound care nurse, psychiatric nurse, child and maternity health nurse. So like that, if they are given with a specialized nursing area, you have to be alert. Okay, I hope this video is useful for you. Just try to write in the same way so it would be easy for you to organize the letter very well. We will see you with another informative video. Until then, bye, take care.